Hi, my name is Caleb Fuller. I'm here today to present the third stage of our chest pain case study. So the previously mentioned interventions were successful at alleviating patient X's pain. He has now been admitted to a medical surgical unit for further evaluation, which includes telemetry monitoring, lab work, and cardiac evaluation. His initial assessment during at the med-surg unit revealed his vital signs were within normal range. His pain is now self-reported at a 0 out of 10, and his EKG is in normal sinus rhythm. His lab work also came in, and his lipid profile panel revealed his cholesterol was 205 milligrams per deciliter. His triglycerides were 182 milligrams per deciliter. His high-density lipoprotein was 30 milligrams per deciliter, and his low-density lipoprotein cholesterol was 175 milligrams per deciliter. So our first critical thinking question: which lipid panel result would you find most concerning and why? And then as a follow-up, which type of medication might you anticipate being ordered for patient X? Although his 205 milligrams per deciliter cholesterol is well over the recommended 180 milligrams per deciliter range, his low HDL or good cholesterol numbers are of key concern. LDL cholesterol, which is known as bad cholesterol, can accumulate and build up in the arteries over time, seen in this illustration. The HDL cholesterol helps remove some of this cholesterol from the bloodstream. If left unattended, the LDL cholesterol over time can cause a buildup of plaque, which is a thick, hard deposit, which can cause narrowing in the arteries. This narrowing can lead to heart attack or stroke if left undealt with. And that's why we're primarily concerned with his low levels of HDL cholesterol. You might also anticipate a statin medication being ordered for patient X. Statin medications block a key enzyme in the liver used to produce cholesterol naturally in the body, and statins also help the body to naturally reabsorb some of the cholesterol. So based off of the Agency for Healthcare Research and Quality National Angina Management Guidelines, patient X was prescribed an angiotensin converting enzyme or ACE inhibitor, nitroglycerin, as well as a statin prior to his discharge. As part of patient X's discharge teaching, which common side effect of his newly prescribed ACE inhibitor, lisinopril, should you educate him about? Well, as many as 20% of patients prescribed ACE inhibitors develop a severe dry cough. If severe enough, this cough may lead to the patient having to come off that medication. The cough usually begins 1 to 2 weeks after initiating the medication, but it can be delayed as far as 6 months from the initial beginning of the therapy. So it is important to educate patient X about this before he is discharged from the hospital. Patient X had an uncomplicated hospital stay and is released from the cardiology for discharge. Prior to his discharge education, the nurse assesses the patient's readiness for education based upon his beliefs about his angina, a discussion about his risk factors, and coping mechanisms. According to the Agency for Healthcare Research for Quality Angina Management Guidelines, this type of psychological assessment leads to lower levels of anxiety and distress, as well as improved quality of life. Based upon his initial lifestyle assessment data, which areas would you emphasize during your discharge plan teaching? The 3 major areas would be nutrition education, physical activity recommendations, and quitting smoking, or smoking cessation. Nutrition education. As a nurse, it would be important to educate patient X about how to read nutrition labels, as well as good nutrition habits. The DASH diet is a great tool to teach patient X. It's recommended by the American Heart Association, and it has also been proven by studies sponsored by the National Institute of Health to lower blood pressure. The diet is basically a modified version of our food pyramid, which we were taught in grade school. It recommends healthy fruits, vegetables, while limiting fat, saturated fats, cholesterol, and salt. Patient X should also be educated on the importance of introducing some type of physical activity. Of course, he should be cleared first to begin an exercise regimen, but once cleared, the American Heart Association recommends that he begins to walk for 30 minutes to an hour, 3 times a week, and then he can gradually build from there to improve some of his heart function and strength. And lastly, patient X should be instructed on the importance or the detriments of his smoking and given some information and resources about how he can go about quitting smoking. Information about nicotine gum or the patch as replacement. There's some medications that can help him quit, such as Wellbutrin and Chantix, which many of us have seen a commercial for. And then lastly, he should be referred to a support group. Support programs are essential because they teach the patient both behavioral and psychological techniques to aid in the quitting process. To conclude, it is important to overall empower patient X to take control of his risk factors for heart disease or cardiovascular disease. All of his risk factors act synergistically to raise his overall risk, so his ability to lower any one of these can be greatly beneficial for him. The American Heart Association would be a great reference to refer him to. There's a ton of information on there that could definitely aid in his ability to change some of his lifestyle habits. That concludes this presentation, and I appreciate your time.